In this video, we will talk about the history and development of safety and health movement in Malaysia. Safety and health awareness has a long history. There is evidence of occupational safety and health efforts as far back as the time of the Egyptian pharaohs. The Code of Hammurabi circa 2000 BC contained clauses that could be interpreted as early attempts at workers' compensation. There is also evidence of concern for safety and health during the time of the Romans. Tragedies and accidents have changed the face of the safety movement at different times. Examples of tragedies are the asbestos menace and Bhopal disaster in India. Specific health problems associated with the workplace have contributed to the development of the modern safety and health movement. These problems include lung diseases in miners, mercury poisoning, and lung cancer tied to asbestos. Role of organized labor and union has played a crucial role in the development of the safety movement. Today, the HSE team of a large company might include an industrial chemist or engineer, radiation control specialist, industrial safety engineer or manager, occupational nurse, a counselor, a psychologist, and even a dietitian. Malaysia's milestone in HSE movement. The role of occupational safety and health has been in existence since more than 140 years ago in the late 19th century. The history, role, and development of this department can be explained in 6 eras. It started with steam boiler safety and followed by machinery safety. After that, it was continued with industrial safety and hygiene, and lastly, occupational safety and health that covers every work sector. In the first era, jobs relating to occupational safety was first established in Malaysia in the year 1878, when Mr. William Jivan was appointed as a machinery inspector. His job was to inspect the safety aspects of steam boilers, which was usually used in tin mines. The first steam boiler enactment of Malaysia was believed to be legislated in Selangor, which is the Selangor Boiler Enactment 1892. In the machinery safety era, the steam boiler enactments were abolished and were replaced with Machinery Enactment of 1913 and Machinery Enactment of 1932. With this legislation, inspectors were not only to inspect steam boilers but also to inspect machineries including self-combustion engines, water turbines, and other related machineries. At that time, the inspectors of machinery was under the Mineral Department. This was because most machineries were being used in the mining sector, and furthermore, mining was also the main industry. In the industrial safety era, the machinery department split from the mining department because more inspections had progressed to other industries beside mining. The enactment of Machinery Ordinance happened in 1953. Many things happened in the fourth era, which is industrial safety and hygiene. The machinery department expanded to become factories and machinery department FMD. In the year 1967, the Factory and Machinery Act was approved by the Parliament. Beginning 1968, the post of Chief Inspector, which were previously made up of British citizens, were fully filled by locals. The post of Medical Officer and Surveillance Unit was also created under the Labour Ministry, which was later placed under the Health Ministry. Among other things that happened in this era are the formation of the Anti-Pollution Section in 1971, the enactment of Environmental Quality Act 1974, the formation of Department of Environment, the formation of Industrial Hygiene Section, and the start of petroleum safety activities with the formation of Petroleum Safety Section and enforcement of Petroleum Act safety measures in 1984. The department enforced provisions in the Act relating to transportation of petroleum using pipeline, petroleum distribution, storage, and other related activities. In 1992, the National Institute of Occupational Safety and Health, NIOSH, was formed. In the final era, Occupational Safety and Health era, in 1994, FMD is transformed to Department of Occupational Safety and Health, or DOSH. Occupational Safety and Health Act 1994, or Act 514, was approved by the Parliament. Under this Act, industrial sectors that are covered by it are not only limited to manufacturing, mining, quarrying, and construction industries, but also covers other industries such as agriculture, forestry, fishing, hotels, restaurants, finance, retail, and etc. The Department of Occupational Safety and Health, or DOSH. DOSH is a department that is placed under the Ministry of Human Resources. This department is responsible for ensuring the safety, health, and welfare of people at work, as well as protecting other people from safety and health hazards. The government agency is responsible for administering, managing, and enforcing legislation related to occupational safety and health, or OSH, in Malaysia. The National Institute of Occupational Safety and Health, or NIOSH, is the center for training, consultancy, information dissemination, and research in occupational safety and health in Malaysia. NIOSH was established in 1992 with an endowment fund from SOCSO and from the government. The Social Security Organization, SOCSO, or Pertubuhan Keselamatan Sosial Perkeso, established in 1971 under the Ministry of Human Resources. It is to provide social security protections to all employees or workers in Malaysia. The functions of SOCSO are as follows: registration of employers and employees, collection of contribution from employers and employees, payment of benefits to workers and or their dependents when tragedy strikes, provision of physical and vocational rehabilitation benefits, and promotion of awareness of occupational safety and health. The National Council for Occupational Safety and Health, or NCOSH, established in 1995 under the Ministry of Human Resources. NCOSH is a supreme body responsible for determining the direction and policy of the state in relation to occupational safety and health in Malaysia. This slide summarizes all the OSH activities in Malaysia by different agencies. As a summary, these are the things that have been covered in class so far. We have covered the definition, the importance of HSE, the approach to safety programs, historical perspective of OSH, and the development of HSE programs and organizations in Malaysia.